Today's topic is occupational health and safety. Those who have the textbook, please mention the page number in the chat box. For others, if anyone is joining late, please help them out with the page numbers. So, occupational health, according to WHO, there is a definition for it. Okay. So, occupational health is an area of work in public health to promote and maintain the highest degree of physical, mental, and social well being of workers in all occupations where they are working. In your workplace, your workplace should be such that encourages your physical, mental, and social well being, not harm it. At least promote and maintain it. If not promote, but at least maintain the physical, mental, and social well being of the employees or workers, not cause any harm to these areas. Okay, so that is the motto of occupational health. So its objectives are the maintenance and promotion of workers' health and working capacity. Okay. Uh, the improvement of working condition and the working environment to become conducive to safety and health. Development of work organization and working cultures that should reflect essential value system adopted. Okay. So basically, all these 3 points are just pointing in a way that working condition should be such that it does not cause any harm. It should be safe. Okay. And have a working culture as well that is not harmful. Okay. That has good value system installed and maintain and promote the basic health of the workers. Okay. These are the areas. So healthcare, in healthcare and other medical facilities, there are occupational hazards. Okay, which are very unique to our healthcare environment. You will not find these hazards anywhere else in any other job. Okay. So even after this COVID-19, it has been emphasized the importance of occupational health, emergency response, building capacity in healthcare. Okay. Role of healthcare professionals in managing the transmission of infection. These things have been emphasized. Okay. It has been highlighted how important it is. Okay. Public health emergency has also placed all functions under scrutiny, and the procedures to control and mitigate the risk and hazards have gathered apace. Okay, right now we are striving towards a healthcare system in which we are prepared for any form of healthcare emergency. Okay, so there are a lot of hazards, biological, chemical, physical hazards when it comes to healthcare sector. Okay, so for example, needle stick injury, uh, musculoskeletal pain, that is standing for long hours. Okay, work related illnesses, getting infections at hospitals, stress and overwork, because we are still in the stage of building the healthcare capacity. No country or all over the world has enough healthcare capacity. Okay, everyone is striving to have more healthcare capacity, more staffs on healthcare, respiratory and infectious diseases that get transmitted to the staff. Okay, at biological and reproductive level, there are exposure to bloodborne pathogens, infectious agents or diseases, cuts, lacerations, musculoskeletal injuries, confusions, needle stick injury, and reproductive outcomes are also there. If females in a reproductive age group are exposed to radiation, chemotherapeutic agents, solvents, okay, that shift works that can degrade the reproductive health. At a chemical hazard level, you have disinfectants, sterilizing agents, solvents like alcohol, acetone, benzoin, anesthesia agent, chemotherapy drugs. Okay, these can chemically harm the living tissues of whoever is managing these chemical agents, detergents, um, reagents, acids, phenyls, okay, disinfectants. Coming to physical hazards, exposure to sharp instruments, getting needle stick injury, okay, heat, ionizing radiations, noise, extreme temperature, gas, okay, any leakage of combustible gases can cause physical hazard. Ergonomic hazards like in the way how you sit, you stand, how you strain your body that leads to musculoskeletal injuries. Okay, these are the different areas of healthcare hazards. Okay, so the main area is your bloodborne pathogen. Okay, very important to curb this situation. The three main bloodborne pathogens which the hospital staffs are susceptible of getting infected with. Okay, it is hepatitis B, hepatitis C, and HIV, human immunodeficiency virus. These three are the notorious bloodborne pathogen, which always the healthcare staff has to be very vigilant about dealing with patients who have these infections. So we have post-exposure prophylaxis, which means any staff who have come in contact, okay, with any of these bloodborne pathogens, after coming in contact, what can you do so that you don't get infected? You take the medication, vaccination, whatever is required, which can protect you. Okay. So for hepatitis B virus, there is a certain prophylaxis, the way how you get vaccinated. It depends on your blood serum level, antibodies which is there in your blood serum level. When you're working in a hospital, before you start your job in your hospital, you will always be given a shot of hepatitis B. Okay, hepatitis B is the vaccination you have to take before you start your healthcare work. Okay, so all the healthcare workers are already being vaccinated with hepatitis B antibody. That's an injection, immunoglobulin injection. Okay, so if anyone is unvaccinated, any family member of a hepatitis B person, okay, or a new staff who is unvaccinated, and when you did your antigen hepatitis B antigen test, when it was done, which means to find out if hepatitis B antigen is present in your blood or not. Okay, if it is positive, which means you are infected with hepatitis B virus. Okay, if it is positive, if your antigen positive, hepatitis B antigen positive, immediately get your vaccination, because you're directly getting the antibodies. Your body does not have to go through a lot of symptoms to make the antibodies. Okay, you're directly getting the antibodies from the vaccination. That is the immunoglobulin vaccination. Hepatitis HBIG means hepatitis B immunoglobulin vaccination. Ready-made antibodies, hepatitis B antibodies will be injected in you. Okay, even if you're hepatitis B negative, but still you will be going to be working in a healthcare environment, then it still start the vaccination. Next, coming to a vaccinated responder. Okay, if you're a healthcare responder, and if your blood serum, when you do your blood serum test, uh, in the past you have got the hepatitis B vaccination, but still you have to check if more vaccination is required or not. Get the blood test done. Get the hepatitis B antibodies level checked in your blood. Okay, if it is more than 10 international units per ml, okay, you have more than 10 hepatitis B antibodies in your blood per ml of your blood. Okay, it means you are enough well vaccinated, you have enough immunity to fight this infection, you don't require any more vaccination. Okay, even if you're positive or negative, doesn't matter, your blood will take care of it. Okay, vaccinated non-responder. Non-responder means even after vaccination, your body is not responding to the vaccination. Okay, you got the vaccination a few years back or recently you got vaccination done. You did your blood analysis, serum analysis was done, and it is seen that your hepatitis B antibodies in your blood serum is less than 10 international units per ml. Okay, very few hepatitis B antibodies you have in your blood. Okay, so if you are positive, immediately start the vaccination, start the revaccination. If you are negative, no need for vaccination, because most probably you will be wasting the vaccine. Okay, so only if you are positive and you are a non-responder, get the vaccination. Okay, so what is a non-responder? It's a person who does not develop this protective antibodies even after completing two full series of hepatitis B vaccination, and even after getting the booster dose, your body is still not able to develop this antibodies. Okay. Next, coming to the post exposure prophylaxis for HIV. Okay, if you are exposed to an HIV positive patient's body fluids or blood, okay, what can you do to protect yourself? Post exposure, after being exposed, can you do? What treatment can you take? Okay, so it also depends on the grade of injury. Okay, is it a uh, superficial injury or a large bore injury? Okay, small volume blood splash was there, or a big volume blood splash was there. Okay, was it a deep puncture or a superficial puncture of the needle or any sharp object? Okay, based on that, if the person is HIV negative, after doing the blood serum analysis, ELISA test has been done, and if the staff is not positive, it's negative, no need to give any post exposure prophylaxis. No antiretroviral drugs should be given if the test is negative. But if the test is positive, even though it is symptomatic or asymptomatic, doesn't matter. Okay. Triple therapy. Triple therapy means three types of antiretroviral drugs has to be given. Okay. If the test comes as positive, if it is symptomatic or asymptomatic. Certain HIV patients are asymptomatic because their viral load is very less. Okay, they have less than 1,500 copies of virus in their blood per ml of blood. Symptomatic, it's usually more than 1,500 copies of virus per ml of blood. You will have the symptoms. Okay, that is high viral load. You may have AIDS. Okay, so in such case also, in both this situation, if it is positive, symptomatic or asymptomatic, doesn't matter. Triple therapy has to be started. Okay. Just give me a moment, 1 minute. So for post-exposure prophylaxis for other disease conditions like measles, varicella, okay, that is varicella zoster, measles virus, chickenpox virus and all, okay. Measles vaccine within 72 hours after exposure. Okay, if you have treated a person with measles, 72 hours after being exposed to the measles virus, get the medication. Okay, or sometimes the incubation period for measles is a bit of a 3 to 4 days. Okay, so then you can directly get the immunoglobulin within 74 hours. If you don't get the vaccination, if there is any delay, after within 6 days you can get the immunoglobulin, that is directly get the antibodies. Okay, so this is for the high risk person. Varicella vaccine as well, that is a chickenpox vaccine. Within 120 hours after exposure, get the varicella zoster vaccination. Or if there is any delay, within 96 hours, you can directly get the immunoglobulin vaccination also for a high risk person. Okay. If it is not a high risk person, like not a small child or a senior citizen, okay, if you are an adult, healthy adult or a teenager, directly get the vaccination. That is more than enough. If you're a high risk case, if you have you have a suppressed immunity, okay, you have other infections going on and all, so you are a high risk case, so in that case better to go for immunoglobulin. Okay, directly get the antibodies. Tuberculosis, you have to report to the infection control practitioner, staff health nurse. Okay, depending upon the hospital protocols and all. Then for meningococcal meningitis, You have to provide chemoprophylaxis with ciprofloxacin, that is an antibiotic. Okay. So next is needle stick injury. Most common cause of most common cause of spread of infection among healthcare workers. Okay, needle stick injuries are wounds caused by needles or any sharp that accidentally puncture the skin. Okay, so you can see in this pie chart, 30% of the needle stick injury, that is majority of the needle stick injuries, happen when you insert an IV cannula. So obviously nurses are at the highest risk. The second category goes for handling garbage bag. So biomedical waste handlers are at the second highest risk. Then comes the doctors, junior practitioners, dentists, and all. Okay. So the causes of a needle stick injury, we can make it out from this pie chart. While inserting IV cannula, you have to be careful. Handling garbage bag, a sharps garbage bag. During dusting, that the housekeeping staff has to be careful. Handling suture needle, doctors have to be careful. Subcutaneous injection, nurses has to be careful. Recapping the needles, whoever is giving the medication or administering the medication and discarding the needle, they have to be careful. Withdrawal of blood, technicians working in the laboratory or the blood bank, they have to be careful. Okay, these are the areas. So needle stick injuries among healthcare workers, you can see here nurses are at the highest risk. Okay, then the junior medicos who have new staffs, okay, medical staffs who are newly completed their courses and all. Then your auxiliary staffs, your biomedical waste handlers, dental staff, student nurses. Okay, but nurses are at the highest risk, and second is the biomedical staff who are at the highest risk. So key requirements to recommendations to keep in mind for safe injection practice. Okay, infection control. Follow proper infection control practice, aseptic technique during the preparation and administration of injected medications. Whenever you're doing any IM, intramuscular injection, intradermal, subcutaneous, IV, any form of medication you're administering through a sharp, be very careful, follow all the aseptic techniques. Never administer medications from the same syringe to more than one patient, even if the needle is changed. Okay, follow that rule. Never repeat the syringe or needles. Never enter a vial with a used syringe or needle, a syringe or needle that you have already used on a patient. Never poke that needle again on any unused vials or used vials. Okay, if a needle has touched the patient's body or have been inserted into a patient's body, after its removal, it should go straight into the sharps bin. Okay, it should not be used anywhere else because the quality of the needle also degrades with the first poke itself. Okay, with the first insert itself, the quality of the needle, the sharpness of the needle degrades. Okay, so it cannot be used again on the same patient. It cannot be used on vials as well. Okay, do not use medications packaged as single dose or single use for more than one patient. That is injection safety. Okay, vials or ampules that are single dose, use it for the patient. Even if a small amount of medicine is remaining, you can discard it. Do not keep it for second use. Single use medications should be used only once, and even if some medication is remaining or dose is remaining, discard it. Do not keep it for the next day or next patient. Do not use bags of intravenous solution as a common source of supply for more than one patient. Okay, one intravenous solution should be cleared by one patient only. Okay, even though the intravenous uh, solution bag was not completed by the patient, you have to discard it or give it to the patient on discharge. Okay, but do not use a half-used intravenous bag for any other patient. Okay, it should not be used as a common source of supply. Limit the use of multi-dose vials as much as possible. And if at all certain medications, they only come in multi-dose vial, you have to use it for single patient only. Okay, do not make a multi-dose vial for two to three patients. Okay, keep one multi-dose dose vial for one single patient. Okay, and limit it. Always use face mask while injecting material or inserting catheter into the epidural or subdural space during the anesthesia and all. Okay, to prevent splashing of the blood or CSF fluid. If a needle stick injury has taken place, what can you do? What has to be done immediately? If a nurse or any practitioner gets stuck with a needle or got a needle stick injury, you have to immediately stop the procedure. You have to wash the wound with soap and water. Some policies say you should not wash, okay, but some policies say that you should wash it with soap and water. You have to encourage bleeding and apply antiseptic, because make sure whatever may have gone in through the same wound comes out through the bleeding. Okay, so encourage bleeding and apply antiseptic. Immediately report it to the nodal officer in casualty for first aid. Send the staff to the first aid in casualty. And then you can do the test, also blood test as well. And if you can retain the needle which has caused the injury, send that needle to the microbiology department for verifying if it was uh, infected with any pathogen or not. Okay, if it is, if you get the needle which caused the injury, it was retained. Okay, only in that situation, send the needle. Okay, retention of the items if possible, because you have to investigate it, determine what pathogen was there, and based on that pathogen, you have to take a post-exposure prophylaxis. Okay, remedial measures has to be taken. In the casualty, whenever you go, post-exposure prophylaxis for all the pathogenic infection is available. Okay, 24/7 it is available. Each and every needle stick injury should be recorded. Okay, no needle stick injury should go out of records. Every needle stick injury should be recorded. Okay. So that's about occupational safety.